Here is your question. Right. So if you have read and understood, considering this surgical pathology station, kindly please tell me what would be your provisional diagnosis for this patient?
My provisional diagnosis would be a parotid tumor, probably benign or malignant parotid tumor, such as a pleomorphic adenoma.
All right,
or
good. Yes. How would you confirm your diagnosis? What investigations would you ask for?
Ma'am, confirmation of diagnosis would need cytology or histology
Yes.
of FNAC or two-cut biopsy.
How, according to NICE guidelines, how should an biopsy be taken?
I'm not sure about this one.
Okay, you have to say, I'll come back to this question later. All right. Considering the patient's sign and symptoms which are given in the stem, what would you state if there is involvement of facial nerve or not? Or could there be presence of malignancy in this particular patient or not?
Yes, ma'am. There could be a presence of malignancy if
Yes,
there is
how?
a facial nerve involvement, or
Yes,
if there is fixity to the overlying skin or the
very good.
underlying muscle, or
Yes,
if there is a rapid increase in the size of the swelling,
yes,
or if there is an ulceration or presence of lymphadenopathy, associated lymphadenopathy, then we can suspect malignancy.
very good. Okay. Can you already, okay, will imagine you haven't told me. Can you please tell me what are the types of parotid tumors that you know of?
They can be benign or malignant, ma'am. The most
Yes,
common benign tumor is a pleomorphic adenoma. Then we have Warthin's tumor,
yes,
and then oncocytoma.
yes,
And tumors, the most common is the mucoepidermoid carcinoma.
yes.
Then have adenocarcinoma, then adenoid cystic carcinoma, and
Okay.
carcinoma ex pleomorphic adenoma.
Considering pleomorphic adenoma, can you histologically describe its appearance?
It is a benign tumor, ma'am, which consists of myoepithelial and as well as epithelial cells in a
Yes,
variable background of stroma,
yes.
which can be chondroid, myxoid, or mucoid stroma.
Okay, can you describe or explain the images that you're looking at, please?
Yes. This is a CT scanning axial cut and coronal cut of the head, showing swelling in the left parotid region, which
Okay,
appears to be
this arrow pointing at, yes, the swelling, which appears to
cap
be parotid region swelling there. Could you,
encapsulated.
yes, please
Yes.
continue.
It appears to be capsulated, ma'am.
Capsulated. That's why. How would you, how would you interrupt? What could that be?
It could be a benign tumor, ma'am.
Yes. Why? Because it's clearly demarcated and
Yes.
it's capsulated. All right. Right. One you've already told me. Is it any other possible way of finding out if the tumor is malignant?
Uh,
Maybe during surgery, intraoperative.
Bony erosions.
All right. Very good. And while operating, you can take frozen
Frozen
section.
section.
Yes. Very
Operate
good.
with frozen section.
All right. If I ask you to differentiate between cytology and histology, what would be your answer?
Cytology is the study of the cellular structure and function, ma'am. Whereas histology, we examine the tissue sample as a whole,
Yes.
and it can help in assessment of the malignancy.
What should be the best way of taking a fine needle aspiration cytology?
Ultrasound guided
Very good.
best.
Yes. That is what an NHS recommendation is. All right. Okay. During you were doing FNSE and your assistant was also assisting you. And while doing or taking FNSE, your assistant got needle pricked. What would you do?
Ma'am,
Or
firstly,
what should be done? Yes.
I'll ask him to wash the wound copiously, then cover it with an impermeable dressing, then assess the incident risk, ma'am, whether it is a type of what type of injury it is, then assess
Yes.
the patient whether he's a known case of any bloodborne infections, and investigate the patient for hepatitis B, hepatitis C, and HIV,
Yes.
and also test the uh, assistant.
Yes.
And in the while, I will ask him not to assist for further surgeries till the test results come out.
Very
And
good.
if the is a known case of a positive, then post-exposure prophylaxis will be needed.
All right. When taking the biopsy, there are two other terminologies which come or which hold a real good importance. High sensitivity test and high specificity test. What do you understand by these two terms?
Sensitivity is the ability to identify true positive cases,
Very
ma'am.
good.
Whereas
Yes.
specificity is the ability to identify the true negative cases, ma'am.
If you have while you're operating or you're excising the tumor, is there a way that you can evaluate if the tumor happens to be malignant?
Yes, ma'am. Intraoperatively, we can go for a frozen section
Yes,
where
that we have done. Yes. Anything else?
um,
Or under the microscope, definitely what are the features you look for
yes,
to, yes,
invasion of
label
the
it as, yes, to label it as carcinoma or malignant. You look
yes,
at the loss of differentiation. What else?
yes, ma'am. Invasion of the basement membrane and
Yes.
surrounding tissue, the
And
loss of differentiation, then anaplasia where the tumor cells
yes.
are uncreated,
And,
and pleomorphism, ma'am.
and yes.
Increased
Mitotic activity. Yes.
yes, ma'am. Increased mitotic activity, increased nuclear cytoplasmic ratio, and prominent nucleoli,
Very
and
good. Variability in the cell sizes.
yes, ma'am. Pleomorphism.
Okay, what advice would you give to this patient after surgery? It's a young patient, 47 years old, not that old. After you've taken the sample and you've sent, would there be any advice you will give to the patient?
Yes, ma'am. I would advise the patient to stop smoking if
If she is smoking, yes.
he is a smoker. Then avoid tobacco chewing as well, and also regular follow up to look out for any recurrence.
Yes. And you've taken the sample and you'll ask her to come after 2 weeks for the result.
Yes, ma'am. A
Yes.
review of the report.
Yes. And since patient is already complaining about the loss of appetite and marked weight loss, then what should be done? You book or
Good
you'll
nutrition.
discuss. Yes. What?
I will advise the patient to have good nutrition, ma'am, where protein-rich
And
food
why?
and
Yes.
uh,
You'll book the meeting with the MDT to discuss the case, because now you have to, after 2 weeks, patient will come and then you have to decide the management.
okay. Yes.
Yes. Yes.
Yes.
Good. Thank you.
Thank you.